Sciences. It's the first webinar of a series of webinars focusing on the research challenges for the students. The title of this webinar is Becoming a Successful Researcher, Key Knowledge and Principles. We are planning to discover the essential knowledge and principles to excel as a successful researcher in dentistry and beyond. And it is a great honor for us to host four eminent professors around the world. Professor Pieter Slootweg, Professor Senada Koljenovic. She will join us in several minutes, and Professor Shweta Agarwal. And it's an honor for us to have Professor Alikhassi. She has not joined the meeting so far. We was planning to start this meeting with her presentation. However, but we would like to start this program with the question panel. We asked the students of the university to share their common challenges and the common questions with us, and then we can share them with the eminent professor in this meeting. Therefore, I would like to start this part of the meeting with the questions section. First of all, I would like to ask Amirhossein to introduce our guests. Amirhossein, please go ahead.
Hello, everyone. Hope you are doing well. I'm Amirhossein Mohamadi, the head student of the Students International Committee of Dental School, CICODS. It's my great honor to continue introducing our distinguished professors who will sharing their valuable insights with us today. First, we have Professor Pieter Slootweg, Emeritus Professor of Pathology at Radboud University Medical Center in Nijmegen in the Netherlands. Next, we are pleased to welcome Professor Senada Koljenovic, Professor and Head of Department of Pathology at Antwerp in Belgium. We are also honored to have Dr. Shweta Agarwal, Head and Neck Pathologist at Mayo Clinic, Florida, Harvard Medical School, United States of America. We are deeply grateful for their participation today, and I continue to ask my first question for Dr. Pieter Slootweg. Dr. Slootweg,
Sorry, Amirhossein. Sorry for interruption. I see Professor Alikhassi. I think she's with us now. Dr. Alikhassi, can you hear me? Please put on your audio. Please unmute.
Hello, do you hear me?
Hello. Yes, great. Thank you.
I'm sorry for delay. I couldn't connect correctly.
Okay, no problem. Professor Alikhassi, are you ready for the presentation? Can you share your screen?
Yes, I try my let me pause. Share. Could you help me? How can I share my screen?
Yes, please share using the green arrow. And you can share it. Yes, it's good. Great. The platform is yours, Professor Alikhassi.
Okay. Good evening, everybody. It's a pleasure for me to be here in this insightful webinar. First of all, I would like to extend my gratitude to Dr. Shakib for organizing this event, and also to Amirhossein for his excellent role as a moderator. It's always inspiring me for to see students on leadership roles in such a discussion webinars. I also want to express my appreciation to our distinguished speakers, Professor Slootweg, Professor Senada, and also Dr. Shweta, I hope I pronounced correctly the name, for sharing their expertise with us. It's truly my honor to be part of this panel. Today we want to talk about research, and in my belief, research can transform students' career as a dental or medical student, no difference, whether they dream to be a clinician, to be academic, or specialist, no difference. I think research is a powerful tool for them to grow, innovate, and make difference. First of all, I should say something. Many students come to me, I don't know about other professors, but many students come to me and say, we want to do research. When I ask them, they say, we want to have article. Research it's not just publishing paper or presenting at conference. And I want to talk about some key knowledge and principles for doing research, and the importance of research for students and also for recently graduated students. They usually ask me, why should we involve in research? What is it? It's beneficial for us. Research enhance their learning. As a dental student, they spend countless hours studying textbook and practicing clinical skills. But research takes their learning to a next level. It can they understand how to have critical thinking, problem solving skills, and in this way they can improve their and they improve their knowledge. They can prepare themselves for the future. For example, they know how to do data analysis, scientific writing, project management, and all of them build a strong foundation for their specialty training. By doing research, they will be a better clinician. They know how to do evidence-based practice. For example, they want to find an answer for the treatment, evaluating new treatment, new modalities, technologies. They know how to interpret these new technologies and also new materials in their practice. One of the important things that I think research can do for the students and dental or medical students, it's making professional network for them. They can collaborate with mentors, peers, experts in their field, and it will be very good for other opportunities, for example, attending in residency programs or involving in clinical practice. They will be a different dentist or doctor when they try to do research. But some students tell me that, okay, we do research and now we have graduated. Is it also good for us as a graduate dentist to continue researching? Is it good for us? My words is based on the questions I asked from the students to, I asked them, what are your questions about research? How could be beneficial researching for you? And they asked me, okay, we have graduated. Is it also good for us? I should say that it's just as important for them because dental field is highly competitive and research can set them apart. They can be competitive in their field. They can think critically, solve problems, and continue to the advancement of their field. They also can bridge the gap between the academia and the practice that they have. For example, they want to know the effectiveness of a new material or technique in their clinical setting, and they can translate the academia into the better patient care. They can make a professional identity. They can have their connections in the conferences, with the other researchers, and they can know how to encounter the challenges they have in their practice. Another question they usually ask me is that I hope that other professors also help us in answering these questions after my speech. For example, they ask me how a young researcher can get enrolled in the research. As I asked you, as I told you before, many students tell me that I want to have article. And when I ask them which type of article you want to write, they say, no difference. I want to write an article because I am expert in scientific writing and I'm expert in English. But, they should first identify their interests. They are passionate about what? Implantology, orthodontics, which one is better for them? They have question about which field of dentistry. And when they have identified their interests, they can have clear direction for their journey in the research. And the other step is to find a mentor. It's really important for them to have a good mentor, especially at the beginning. And a mentor can help them to refine their research, they design their way, but they should know that mentorship is a two-way street. They should be active, they should be respectful and willing to learn. That sometimes we do not have all these, aspects when students come and want to do research with us. Other things that they should consider is that they should start small steps. Some students come and say, we want to invent something in dentistry and believe that this is the research that they should do. But it's better to start with the small steps, and in this way they can have confidence and they can develop their skills gradually. They should follow any opportunity they could find. For example, they should attend research workshops, seminars, and conferences. In this way, they can have collaboration with other researchers and they could find support from them. And they should share their finding. The sharing is not just publishing an article or presenting in a conference. They can share it in some professional platforms, the same as LinkedIn. Sharing their research contribute, can help them to show them as a serious researchers to others. And what new researchers usually ask that, for example, the great mentors accept beginners. We are beginners and great mentors doesn't work with us. This is another question they usually ask us, but they should know that great mentors do accept beginners and they often love working with them. It is my belief, maybe other professors say something else, but they accept because they were also beginners sometimes. And sometimes when we go deeply in a topic, we can see the other angles of that topics. But beginners bring fresh perspective, especially the new generation has some skills that sometimes I don't have. For example, they know how to work with AI, how to work with the new technologies, and these skills could help us in our researches. They can start small and build the trust with the professors. They shouldn't fear of being a beginner because they should know that each expert researchers was beginner before and they love to work with new talents and students that have talents in doing research. Another question that students ask me when I told them that I want to say something about research for for the beginners, they told me it's a systematic review is good option for starting a research. Yes, in my belief, I hope other professors help me for answering this question. Yes, it's acceptable to start because systematic reviews teach critical thinking and analytical skills. that both of them are very important for students from the beginning of the research, but it doesn't need any resources, and it can lead to publishable work as it is written in a perfect way. But it has some challenges. For example, it needs meticulous research, literature search. It needs expertise in scientific writing. The students should be patient and dedicated to the analyzing the data and synthetic of the research. But it's very good, in my belief, it's very good step in starting research for the student. But some students want to have some lab work, or they want to do, for example, some survey-based research. Some of them love to have research on the innovations such as digital dentistry and so on. They can find their interest in other types of research as well. They can join the teams that are doing that, but they should know that they should shadowing the research team at the beginning. When the professor, when the experienced researchers can trust them, they can bring them under their wing of the research. Finally, the words I want to say is that research is not just about discovering new knowledge. It's about discovery of yourself, to know what you love to do, what's your interest, what's your capability, how can you learn about critical thinking, problem solving. And when you consider this with practicing research, of course, you will be a great researcher in future. Thank you, Dr. Shakib. Thank you, other professors. I tried to open some questions at the beginning. I hope others, I'm sure that they can better answer to these questions.
Great comprehensive and well-descriptive presentation. Thank you very much, Dr. Alikhassi. I think I would like to start this next session with the last sentence of your presentation, that the research is about discovering yourself and your potential and your abilities. And it is very important take-home message for all students in this panel. Before getting started the question, I would like to invite Professor Slootweg to share his ideas on this topic. Do you have any comment on this presentation, Professor Slootweg?
Yeah, I have to unmute. Yeah. Well, Pooja, thanks, and also thanks to for a nice presentation. That is a good overview. How it can be done for a young and aspiring student to enter the field of research. But my basic comment, and I made a few notes, is that I think it you are putting quite a lot of emphasis on the student, because you think the student should start with identifying his interest, then looking for a mentor, and also look for funding and opportunities. So that requires a very active student that already knows what she or he aims. And I can imagine another situation, that there is a student who wants to do some research, but not yet knows what and about. And in my experience, most students are just coming to a mentor and asking the mentor if there is something they can do in in an already existing research environment. So then the initiative for a topic is not so much in the student's mind. The student is someone who thinks, I would like to do research, and then the mentor can offer some subjects that are worthwhile to be done. And of course, we will start small. And I also think that it is not a duty for a young student to provide his own funding. Funding is the duty of the mentor. The young student should not be burdened with commercial activities, but be completely free to pursue her or his own things. That's effect for me another way. So it's not a student with an idea looking how to make that idea reality, but a student thinking about doing research and looking for joining an already existing research environment in which he can be accommodated. And that's my comment. And another comment is start small indeed. And I've often seen that a good way to start research is just writing, or at least a case, an individual case, a case report. Case reports, that's just an interesting case. Look what has been written about that. Look about the difficulties. That's a nice connection between the clinic and research, just figuring out and presenting an interesting case to a committed audience. So far, my things.
Okay, great. Thank you for sharing your ideas with us, Professor Slootweg. And before getting started sharing the question, let me ask Professor Shweta about her comments on this presentation. I know you are working at the one of the big and well-known pathologic center in the world, in Mayo Clinic. I think you do a lot of research and you have a lot of research project and at your center. Do you have any recommendation at the first part of the discussion for the students who have participated in this panel?
Yeah, first of all, I want to congratulate Dr. Alikhassi for an excellent presentation. I think your points were right on. Like, I agree with most of them, kind of like having an interest and finding a mentor and kind of like not going after publications. And in my personal experience as well, when I started off as a faculty about 10 years back, or 8 or 10 years back, the first time a researcher or a student approached me was they wanted to just have a manuscript published, because all like it's not like something that can be taken in a wrong way, but obviously they want to build, everybody wants to build their CV, have a visibility in their area, so that's somehow can overwhelm the students to like have a quick publication and have something in their CV. But as I would say, I have had some experience, and I also started somewhere, right? Like when I started writing these manuscripts myself. So my suggestion to the students who are starting off in the research is that you should first of all see, like, as Dr. Slootweg mentioned, that not everybody has that kind of mindset when they actually start off as researchers. So first, I think they might approach you, and then as faculty, if you might have a small project like a case report, you can just, because writing and having the research mindset is very different. It's totally different. Like writing skills somebody can have writing skills, but they don't know how to do a literature search and kind of extract the points from the literature. Or somebody can have that, but they don't know how to write an article. So I feel like both of them have to come together. And first of all ask them to like just work on an interesting case report, do the literature search and kind of compile the data, and then kind of go from there and then start writing, because it's kind of like a storytelling. I always tell my students that case reports are basically you're telling a story to an audience, and like how you tell it becomes you have to make it sellable, because there's so much competition out there for like these simple case reports and research articles to be published in high-end journals. So you need to know like how to kind of sell your product or whatever you're trying to say to the audience. And then I think interest is important. Like if people would be interested, it's the same. Like if you love your job, you're good at it. So the same thing, like if you pick anything, like say for example, I'm an anatomic pathologist, and somebody from, if I'm doing like research on a heme path or a hematopathology subject, I won't be that much dedicated to that, right? Like it's kind of like, okay, I'm doing it just for a publication's sake, but your best comes out when you actually are interested in something and you love that. So that would be my recommendation. Then just kind of like don't go after something which you don't think you will be able to complete. So it will be not be, it will not be justifiable to you or like your mentor who's trying to put in equal kind of effort in your like development. So just commit to things that you think you will be able to complete within the deadline. Don't overcommit, and then kind of like find your interest and go from there. Does that sound okay?
Yes, great comments. Thank you. And I'm very happy that we have Professor Senada Koljenovic. Thank you, Professor, for joining us, and it's a great honor for us to have you. I know that you are not a researcher, but not only a researcher, but also a great leader at Antwerp Hospital. And we have started this meeting with a great presentation by Professor Alikhassi. All professor emphasize on the importance of starting the research project with small steps, including case reports, reviewing articles, some efforts like these steps. Do you have any comments to start your comments at this part of the meeting, Professor Senada? Do you have any recommendation for the students who would like to get involved in research project? What should they do at the first steps?
So thank you very much, Poyan, and I'm very sorry for being late. I don't know, there is some delay in translation. It is in my agenda at 15 o'clock my time, and I see that I have missed a small part. Sorry for that, but of course we can catch up. So indeed, I am Senada Koljenovic. I am a pathologist with special interest in head and neck pathology. I'm so happy here, though it is online, to see our great professor from Netherlands, Professor Slootweg, who taught me especially salivary gland tumors, which I still am happy with. And thank you for the invitation, definitely. So even though I've missed, just a second.
No problem.
Niet nu, alsjeblieft. So it is one of our trainees chasing me. So it's about how to start research. I don't know. There is no general recipe, of course, but what I can say is start it. Do something about it. Don't be academic citizen without any questions why things are going like they are going or why they are not going. That it should be. So within our field, our medical and dental field, you should ask the questions. You should not be the one who nod yeah to your supervisor and then put in your report whatever they want. No, you need to be critical. And it starts with being critical and then being analytical yourself. And of course, search for a good supervisor. That is also very important, to have someone who is real example for yourself. And exactly as a colleague just said, don't publish to publish. Even though these days we are like forced to publish, but please don't do that. Don't go that low level. We need to show quality. So using the same criteria for yourself and choosing your supervisor whenever you have choice, of course, would be for me starting point.
Great. Thank you very much. And this is time for the for sharing the questions previously sent by the students to the organizing committee of the conference. Amirhossein, would you please share the first question with Professor Slootweg?
That question is, how can students ensure their research addresses real world problems? Okay?
Yes,
That's
yes.
the question.
Also, Amirhossein,
Yes.
sorry, Amirhossein, would you please share the question in the chat box as
Oh,
well? Yes.
okay.
No. Please, Professor. Amirhossein will share it in the chat box.
Yeah, yes, Amirhossein, do that, please.
Yes, for
Oh, yeah.
sure.
Yeah, that's indeed the question I was
Great.
looking for. That's
Yes.
so
Great.
far. Great. Well, I think in this way we are asking too much.
Mhm.
I don't think that students are in the position to think for themselves how their things will address real problems. I
Mhm.
think mentors should do that. A mentor, a qualified academician, they should guide students. You cannot expect junior students just entering the field what is really of interest. And that was in fact the point that I already made before. We should not leave it to the student to make a choice for a topic. The choice, we need a student with an open mind, and the supervisor has to fill that mind. The supervisor should say, well, I see that you are a good guy. Probably we can do something together, and I think this will be of interest. And it's my experience that students will grow into that subject, and maybe initially it may be possible that they don't like it, that they may think, well, it's really not very interesting. But when you delve into a subject and you have a good guidance, the interest will come. They will see how important it is. So the interest will grow together with getting involved. And that's my idea. And so it is not for how can students ensure their research addresses real world problems just by looking for a good mentor who knows about that.
Okay, you mean that the mentorship and finding a good and
Yeah.
is the first and the most important part of
Of,
starting a project for the
yeah.
students.
Of course, the student can have an idea, and then the mentor can say, well, that's a good idea. We can go on with that. But he can also say that's not a good idea because it doesn't address a real problem. It's too big. It requires too much money. We don't have the right tools to do that. So in fact, the 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 young colleague should be nurtured.
Yes, exactly. You mean that professors or mentors are well familiar with the problems in the
Yes,
real world, and it is necessary to follow the mentors, the professors, to find a well project, an important project to perform.
of course, because the mentor is responsible. And a mentor is responsible for the initial performance of the young student. And the student cannot take that responsibility for herself or himself. And
Great.
that's so maybe I am a little bit old-fashioned, but it's my experience that when you give a young student too much freedom, the risk that there comes nothing out of it is great, and that maybe a young colleague will be lost for science at all due to frustration.
Yes. Yes, I understand. It's great comment on this topic. And Amirhossein, let's go to the next question with Dr. Shweta. Could you please share the question with Dr. Shweta and send her question, the questions from her to the chat box?
Yes, I thank Dr. Slootweg for his practical advices. Dr. Agarwal, in your opinion, what essential skills should students develop to conduct effective research and write high-quality scientific articles?
Okay, so I think this is kind of a
Can you share it? I'm sorry for the interruption. Can you share? Oh yeah, okay,
Yeah,
thank you.
yes,
Because
yeah,
it
yeah,
comes.
yeah.
Thank you very much.
So yeah, I think this has two parts. I would say the question is two parts because the first part is like the essential skills, and the second is how to develop the writing skills. And as I was mentioning earlier, those are very different ideas. Especially personally, working with quite a few first timers. I have mentored a lot of first timers who came to me for research, and I gave them, as I said, I gave them a small article to write. I've almost always kept an open door policy for my students to like just come in, email me, or like just get in touch if you are having trouble writing the article. And then kind of like, okay, how much time do you need? So you have to be kind of like, if you commit to something, you have to be dedicated to that. That is one essential skill that I see and I try to find in my students, because we are busy, like we are as mentors as well, we are like, we are doing clinical, we are doing research, we are also doing teaching. As in my role as in Mayo Clinic, and even before that where I was, we kind of like do three things. We are primarily clinical patient care, but then also we do research and we do teaching. So like if you are committing to something, I would say like keep your commitment, and it helps you as well as the mentor who's actually equally giving you the time and the kind of the like a project that like maybe I will take some more time because I'm busy, but I can do it myself, right? That's like something that I am trusting you to write, and then I'm here to help you along the path. And I think apart from that, and I was taking notes as people were speaking. So the drive has to be there, like the person has to be driven, that like, okay, you're a first timer, but you really have the drive and the patience and the perseverance to kind of continue with that project. There can be steps in the middle of the pathway that you might feel like, I'm lost, I don't know what I'm doing, and I don't know, I'm not an expert in this field. Say for example, like I'm a head neck pathologist, so I give you something to write about a salivary gland or like a thyroid tumor, and you're like, oh, I don't know, but there's so much literature out there, like how to get through it. So just kind of compile your data and sit down with the mentor, and we always have time for the mentees, so we can like guide you through and like, okay, this is how you do it. And I always give them examples of my published research, and I will say just follow the flow and like just kind of see like how you can incorporate your data into this. And then obviously you don't want to like copy, but then you always like have an idea of like how to go through the flow of the article. So like coming back to the skills question, I think the patience and the commitment, and you have to have like a dedicated goal that, okay, I need 2 months or 3 months. And communicate with your mentor, like it's not like just ghosting out. Like I've seen people like they won't be able to complete things, and then they would go into this kind of like so-called guilt, and they will be like, oh, I'm not able to complete, and I committed to 3 months, and then they will like ghost you out. Though don't do that. Like just communicate that these are the challenges, life happens to everybody. You it might just kind of like, if you have any personal challenges or anything, that just kind of like communicate and set the expectations again with your mentor, and everybody will be happy. So and then just commit to things that you think you'll be able to complete. And then the second part, the writing of the high quality scientific article. I think the researching the topic is key to that. So, like if you are a beginner and you are being giving like a review article, say for example, I would say like let's review certain number of adenoid cystics or like something like that, and like what's the role of something like a prognostic marker or maybe an IHC marker in that. So, like researching the topic in and out will help you with the writing. Because if you jump into it, then you will be like going back and doing a lot of modifications. And me, even as a mentor, I've done a lot of modification where I saw that somebody just followed one article and then just kind of like wrote the whole article based on that researched one article. So I feel like do your research, keep compiling your data. There's no rush, and then just kind of like have that mindset of okay, researching multiple articles, going from recent to the back, and then how far you want to go through. And then just kind of like I think conceptualize the rough draft before you actually send the working draft, the first working draft to your mentor, and then go back and forth and like see it, if you read it aloud, and then like see how it makes sense to an audience who doesn't know anything about salivary gland or somebody who already knows a lot. So those are the, I think, ideas that you can put together and create a nice article. And always like ask for help from your mentors. So they'll be happy to help.
Great comments. Let me ask a quick question. I know that you are director of the postgraduate students or residents at your center. Do you have a specific training class or the training class for your students or residents to get familiar to do a project or write an article or a review article? Do you have a specific training class for them?
So yeah, thank you for asking that. So I am the director of the fellowship program, the Search Path Fellowship. Unfortunately, we don't have any like dedicated program how to write any article. But I think as a mentor, everybody is willing to kind of like help out the beginners. But we do have at Mayo Clinic, they offer these special sessions to how to write grants, and they are like
Wow.
grant applications. So that's pretty beneficial for even for like people like me. Like say for example, I'm like 8 years or 9 years out in my practice, and I am like okay, yeah, let's do that, because every time you learn something new from like how to present a grant, because there's so much competition out there for these grants and like kind of getting funding. So that's something that's available at Mayo, but I don't think anything else that they offer in terms of like how to write an article. I wish it was, but I think that's a skill that personally speaking I have also developed over the past. Like when I started writing my first article, and that was in residency, and I think I did a very bad job. Like to be honest, like I was probably my faculty was like probably not impressed with what, because he was expecting a lot from me, and I did it in just 2 months, and I'm like okay, the deadline is coming, and I presented that. But I think from there I learned a lot, because that's kind of like your step ladder kind of experience, that one thing you do and then you kind of learn from that, and it's always like stepping stone to success. So like that's kind of like, and then now when I guide my students who are beginners, I see myself in their footsteps, and I feel like how they will be feeling, and then I can always be available to kind of ask their questions and like answer their questions, and also like guide them through the process. So it's a learning process for everyone.
You're absolutely right. Thank you for sharing your experience. And Amirhossein, please share the next question with Professor Senada.
Yes, Dr. Koljenovic, in your opinion, is it necessary for undergraduates to participate in research, or is it better for early stages of postgraduate education?
And please send it in chat box.
Yes, I sent it.
Also, I would like to invite the audience and the participants to share any additional question with us in chat box, and we will try to provide an interactive session to ask directly your question from the professor who contributed to this seminar. Professor Senada, please go ahead. Oh, I cannot hear you. I cannot hear you. Is it my problem?
Can you hear me?
Yes, it's great.
This is totally crazy. My own microphone is switching itself from one
It's
to
okay.
another. I'm very sorry for that. So first of all, I want to already start discussion on two previous questions to see that I am more than fully, I fully agree with colleagues. The first question that Professor Slootweg was relying on and elaborating on is really totally true. Then I am also very old-fashioned, Professor Slootweg. I think it is our responsibility to take care of our trainees. In whatever sense, if it is a case report that they try to write, or they're already in the PhD established program for 4 years, we need to take care from first to last minute. Of course, we need to give some liberty, especially intellectual liberty, but still, if you leave your young colleagues alone, they will be lost, and probably there will not be much results, and at the end you have frustrated young colleague that you did not took care well enough. So I totally agree, and with colleague Agarwal, I totally agree. You need to sit down, you need to find that time that you don't have because of the love, because of dedication. You always find this time, you create this time, you make the time to sit together. And for me, it really works. I sit together with my PhDs. At this moment, I have a great guy from Iran. Omid Delai is my PhD student on the project that I wrote, of course. This is my problem. I write the project, I got finance, and then I attract the good PhD students. So we have chosen for each other. So I sit with my PhD students indeed, and sometimes it takes really hours to find out exactly what is the analytical way of reasoning, if it is enough, you know. And at the end, after a few hours, we haven't written much when it's about writing, but you achieved a lot that day because you really sit down and you analyze and you turn the sentence 10 times. What if we say it like this? What if we think like this? So it really works. For that part, I really am totally agreeing with colleague Agarwal. My question, in your opinion, is it necessary for undergraduates to participate in research, or is it better suited for the early stages of postgraduate education? This is really very depending on the institution and the situation at the moment you are facing. I think you always must start with research, even for undergraduate, and before that, you need to start with kind of research. You know, I'm not talking of research at the level that we are, as we are seeing, we're conducting. This is another type of organized research. You always need to start with research. As I just said in the beginning, just start and look good, look for good supervisor, or try to find good supervisors. So I think it is necessary to start even before graduation, and to, of course, build it gradually. I cannot, let me put the question other way around, and I really would like you to remind me why. What would prevent an well-thinking, healthy undergraduate to start think as a researcher, to start analyze things, and of course, depending on the situation, to do a little part of ongoing project, to ask supervisor, may I do one experiment? May I do a literature research? May I do one case? May I do anything, you know? What would be against? That person be spoiled? Wouldn't be able to become great researchers later when they become when they grow up? What is the Pujan, tell me, what is this question?
I do agree with you. This is the questions that have been shared by the students for us, and honestly, I have to share with you. However, I'm
joking. It's a very good question, and I really hope that I sincerely hope that I have made my point. I mean, this is what we want. We want to make our young people whenever possible, enthusiastic about research. So you cannot start soon enough, actually.
Maybe I can join. Maybe I can join. In the Netherlands, it's compulsory in the graduation for pathologists. The students have to spend 6 months with research activities, and the outcome should be at least a poster, an abstract, or a presentation. But then, of course, then comes the skill of the trainer or supervisor, because you should accommodate the topic to the interest of students. When you have a student that has no academic aspirations but would like to be trained as pathologist and then going in a private hospital, you will give such a student an entirely different subject to study than when you are dealing with a young colleague who has academic aspirations and would like to stay at university to pursue a combination of clinical duties and research activities. So I think just research is so broad that for anybody there's something to do. But I think at least it should be included, because also when you are in private practice, you should have the capacity to judge whether scientific reports are real or just bug.
Great,
Thanks.
great. Critical thinking and clinical judgment is necessary for all clinicians. And all the dental students are going to be a dentist, and all other clinical aspects of medical environment. Do you have any comment, Professor Senada?
No, that is definitely true, and very well to illustrate the different situation. Like in Netherlands, indeed, it is 6 months of the 5 years education for pathologists, general pathologists I'm talking about, and then as supervisor, you got a chance to guide 1 or 2 or more colleagues, young colleagues who got these 6 months, and depending on the subject, if you already have ongoing research. For instance, I have ongoing research, and then one can jump for 6 months and do a little piece of it, and it's really, really very good. But the point is indeed to teach our young colleagues already at the early stage to critical think and to analyze the problem, to be able indeed to judge if some scientific report has a value or not during the clinical work. So, as I said, you cannot start early, soon enough doing research in order to think as a researcher and analyst.
So I want to contribute something here, and I totally agree.
Sure, please.
With my colleagues, and I feel like something that really happens, and I like that in the United States, and I don't know if people can chime in if it happens everywhere else. We try to give journal clubs to the students, and that kind of is a good beginning where like they can critically analyze the article, which is like maybe they can pick a high impact factor journal and something which is kind of creating a dynamic change in, like, say for example, breast pathology. If there's something about a new marker or like something about new the way we sign out those cases in clinical practice, that's a good start to kind of like have the research mindset, develop the research mindset, and then we can take it from there. Like if not everybody is interested in going into academics, and nowadays I've have like 50% people, they just want to go to community practice and start working there. But but having said that, like it's the mindset. It doesn't depend on whether you're an academic or community practice to do successful research. You can do successful research even if you are in community practice. It's challenging because of the funding and all that issues, but then I think people can publish when they are in community practice as well. So yeah.
Great comment. And the participant, the students, please get started. Your project from tomorrow morning. It's your time. Okay. Amirhossein, please share the next questions with Professor Alikhassi and send it to the chat box, please.
Before sending the question, I want to say something about the
Sure, please.
Research, learning research is the same as other things to learn. It has a learning curve. As Dr. Agarwal said, I had a similar experience. I remember, I think 20 years before, I submitted my first manuscript, and I tried 12 times to submit this manuscript in several journals. And at that time, it was not online. I should go to post office, prepare pictures, print them, send it to, for example, JPD, Journal of Prosthetic Dentistry, was with the post office. And I went to post office, do it in 12 times, and after 12, in the 13 journals, I could have acceptance of my first manuscript. But I learned a lot from revising this manuscript. I know how to write. I know how to design and study. I think we couldn't ask the student to sit here. We want to teach you how to do research. They should start, and during working, they know how to do research in each aspect, doing lab procedures, writing, revising, and each other aspects.
Okay, great. Before going to the next question, I see a question from Amirhossein. Let me share it with all professors. First, with Professor Slootweg. A big problem is about statistical analysis of the results of a research project. Professor Slootweg, do you recommend the students to learn statistical analysis and methods of statistical analysis themselves, or you recommend them to deal with a specialist in this field, or ask somebody who is well experienced in statistics to perform the statistical activities of the research? What's your recommendation?
Well, science is teamwork. You cannot expect that one person masters anything. I think it's the same as we are doing some molecular biological analysis of a tumor. You are not required to know all details of molecular tricks to write a paper on molecular biology of tumors. So, in my opinion, a student should know a little bit about statistics. He should know what is a univariate analysis, what is multivariate analysis, so the terms, but for a paper, rely on someone who is qualified and are not doing jobs that you are not qualified and that takes too much time. Anybody has its own duties, and science is teamwork. So, and I would not say hire a statistician, but ask a statistician to be co-author. So it's not a question of doing a higher job, but it's a joint venture.
Great,
absolutely, great. I agree. I take the liberty, Puyan, to totally agree, and to make a very simple comparison, if I may. All of us, we know how to read and how to write, but it doesn't make us the writers or. So we need to put that part of the job in the hands of someone that really knows how to write. And I think this is very important to involve those people and to understand the value, to know your limits. Just to know that you cannot do that all on yourself. Then you have a high quality research, but you also have teach your students to develop this interaction, this communication in different fields.
Yes.
Yeah, because let me add, a good database, it can be wasted when it's not properly statistically handled.
Great. You are absolutely right. Please, Professor Alikhassi, go ahead.
Some students believe that knowing about the statistics is only for the results section, but they should know that it's not correct to hire a statistician only for the results section. They should be part of the team from the beginning, or you should know about the statistics at the beginning of the designing the study. So hiring at the end of the study for doing the result is not acceptable. They should be part of the team from the beginning. And as Professor Slootweg said, we should do together at the beginning.
Yeah. For other, because the required statistics will also determine the kind of data you are collecting, not overlooking something very important.
Great, great comment. Thank you very much. And Amirhossein, let's go to the next question from Dr. Alikhassi.
Yes. Dr. Alikhassi, from your experience, how can research conducted during undergraduate studies shape a student's future career path or even influence their choice of a specialty?
Yeah, I try to address this question in my presentation. For example, how they can grow with doing research. They should find their interest. I think it's better to share this question with other professors. As I told you in my presentation, this question, I will be happy if other professors have any comments for this question as well.
Yes, please, Professor Slootweg. Thank you.
In fact, this is telling my childhood. As a fourth-year dental student, I did a short stay on a pathology lab, and then looking at a microscope, I decided to become a pathologist. If I hadn't done that kind of research, that kind of connection with the pathology lab, when I was 20, probably I would now be having been a retired dentist and no pathologist at all. So that was the decisive element in my choice for my future.
Great, great. Dr. Shweta, do you have any comments on this question, important question?
Yeah, I think I feel like this is a very important aspect, and I think all of us will agree that there has been some kind of influence in our early career that has kind of like asked us or like influenced us to pursue pathology or the subspecialty that we are subspecialized in pathology. And personally, like for me, it was I feel like you can start your career and you don't have like it's a map. It's kind of like a path that you follow, as Dr. Alikhassi also mentioned, that it's either if even your education side, like when you're learning, when you are doing residencies and fellowships, you kind of take that leap. Like suddenly there is like a leap that you take. Okay, now I'm there. I can handle anything. Like that kind of happens to everybody, and it takes experience. It takes time, but I think it's in the beginning. It's a good way to kind of start small and identify your interest if you actually are interested in research, because not everybody might be. And it's not like something which everybody has to do. If you're going into academics and then you want to build your CV and career on a research kind of path, then you can do that. But definitely it does help and influence your choice of specialty. For my second specialty that I have, cytopathology, was one of the major researches that I did on telecytology that influenced me to go for a second fellowship. Otherwise, I was practically done with one in head and neck. So that's something that can guide your research.
Great. It means that you do agree with this comment that the research we conduct today will shape our future practice in our you know, in our specialty or in our clinics, and it is very important. Do you have any experience, Professor Senada, about it? And do you agree with the importance of the research we conduct today about and the you know, the influential role of this research to our future? You are not audible. We cannot hear you, Professor.
Can you hear me now?
Yes, it's okay.
This is really okay. Something for one of the students to help me arrange. Thank you very much. Sorry. Yes, one part I even couldn't hear you, but I could follow the chat. Yes, definitely, it is very important. But this is something. It is very important, of course, for young students to meet right person and right type of scientific related job in their career. Not all of us will have the chance, you know. And it is very important to, as much as possible, for us as mentors to influence the way of how the education is built, you know. The students should get the chance to meet different specialism, different type of mentors, different type of research during their regular curriculum. To not be left on the chance, if your father is dentist, then you will see how he works with his patients, you know. This should be broad chance for everyone, not only some of us. So I think it is for us, the seniors, to really help build the future of our children and children of their children. It is the moment. And of course, then looking from the side, from the students, as I said, you cannot start early enough. And whenever you, after your critical and analytical thinking, think, oh my God, this professor is the one, is my example, I would like to follow her or his steps. That's it. That's
okay.
it.
Great, great. Yes, please, Dr. Alikhassi. And I have a question in the chat box for you. I think we have a student, Mohammad Reza. I think he's complaining about some professors, maybe that sometimes professors say the students that your manuscript is not well written. Please go home and rewrite it and come back. Please say your comments and go to the questions by Mohammad Reza.
Yeah, I think students should work hard during their undergraduate study to make several chances for themselves, because if they do not work hard, if they don't involve in several researches, they have one dissertation thesis and they expose only to one topic, and so they lose other chances. For example, they have a dissertation with me in prosthodontic, and they say, okay, I think I am interested in prosthodontics, but they didn't experience other specialties. It is their duties and make chance for themselves to be involved. And you know, most of the time we don't see such efforts from the students to be involved in several disciplines to have these chances.
And do you mean that are there any clear criteria to evaluate a manuscript that if it is well written or not, or it is a subjective? Some the students believe that it may not be the objective to evaluate a manuscript. Are there any clear criteria to evaluate the manuscript?
Of course, there are several guidelines for writing a manuscript in a scientific way. Sometimes we see that the basic guidelines is not followed in writing the manuscript. From writing, selecting the words, making the paragraphs, making tables, making graphs, anything that is written in every guideline is not correctly followed. And in this way, of course, a mentor says it's not well-written manuscript. But if the students haven't studied these guidelines and have not been expert enough in these guidelines, think that it is objective opinion. No, of course it's
Yes,
not.
right. Yes, great. And Professor Slootweg, could you please answer this question as well? I know that you have been editor-in-chief of several great journals, and you are well experienced in reviewing the manuscript commonly sent to the journals. Please let us know, what do you think about the guidelines or criteria to evaluate a manuscript?
Well, I think it's very clear. You should always start with introduction, telling why you are doing something.
Yeah.
Then followed by the methods. A good description of the methods. How are you addressing the issue? Then the results, and then the discussion. And what quite often is happening is that in the discussion, new elements are introduced that do not flow from the methods or the results. So quite often things are mixed. Text that should be in introduction is mentioned in the discussion. The methods are not adequately described, and results and discussion are not kept separate. People are already putting parts that should be in discussion in the results section otherwise. So in principle, it's quite simple. And of course, you can start by writing and then going in discussion. You say, oh, this I have forgotten in introduction. Of course, you can go back. You can shift parts of your text between the several components, but in the end, it should be clear. The discussion should not contain elements that do not flow from the methods, the results, or the introduction. In the results, let's say the methods should be in that way described that anybody can reproduce the study. And so it's yeah, in fact, it's what most often happens is that the introduction and discussion and the results are not adequately handled, that they contain foreign elements. That's my advice. And in fact, that's also the major work with my students, that what they are writing is okay, but it's put in the wrong place.
Mm-hmm. Great comments. Dr. Shweta, do you have any comments on this topic? Are there any clear guidelines for the students to follow, or sometimes they're complaining from their professors? Please ignore this problem. Please please rely on what I have written in my manuscript. What is the correct way to write a well descriptive and well written manuscript?
Yeah, I think there are plenty guidelines, and also, as I mentioned initially, when I work with my first timers or beginners, I always give them few examples of papers that have been published. I personally have written them, or I've been a senior author on them, and then I think it depends. It's a two-way process. So you should trust your mentor, and the mentor should provide constructive feedback to the mentee, because just saying that, obviously, like, okay, this is not well written, just go back and do it, without providing any guidance, doesn't take you anywhere. So it has to be both ways. Like if I say, for example, if somebody comes with a working draft and it's very disappointing, it's like, okay, you didn't do a good job. Sit with them and kind of like analyze what was their perspective, how were they approaching the project or like the article, what did they understand from the literature, and then kind of discuss your mindset that this is how I think we should do. And I always write it on a paper. I give them like a format, like okay, this should be the draft, like this should be the flow of like introduction. And as Dr. Slootweg mentioned, like this should be like how, why are we doing it, what is the knowledge gap, like why are we even investigating this, and then kind of like do the methodology and follow some like articles that okay, this is how the article. And also every journal is different, like how they want the article to be framed. So though all those kind of study and research goes in the beginning, like just don't jump into like kind of starting the writing the discussion. I've seen people start writing the discussion before even they know like the introduction or something like that. So take one thing at a time, take one aspect or one focus, and then finish that and work on that. And then always like back and forth. As I said, like the mentor should always be available for the first timer, beginner. It's very challenging for them. And I still remember there was one article that I gave to a first timer, and she just wrote 2 paragraphs and just gave it to me. And she was like, I don't know anything about this new entity, and I need your help. And I'm like, okay, let's sit down. And we sat down together. And I'm like, you did good. Whatever you did was amazing. But then like this is more. We need to add more. So then like at the end, she was very thankful, and also I think it was a very satisfying experience for myself as well, that I trained somebody who was not even like didn't even know like how to write a case report, and then she went on to write like good articles and kind of stepped up from that. So I think it's a two-way process, and don't take anything in like you have to be trustful. Both parties have to trust each other and kind of like work together. That is how the mentorship and menteeship works. Because if you feel like, oh, they're not helping me, then probably not the right mentor for you. So yeah.
It means that it's a teamwork. However, Mohammad Reza, please trust on your mentor and follow the way. Okay, Amirhossein, could you please? I think we have about 10 to 15 minutes to wrap up the meeting. Therefore, I think we have one questions from each professor. Please share, Amirhossein, the next question from Professor Senada.
Dr. Koljenovic, many beginners researchers face challenges when starting out. What are common pitfalls you have observed, and how can the students avoid them?
Okay, thank you, Amirhossein. So many beginner researchers face challenges when starting. What are some common pitfalls you have observed? Okay, more or less we already have discussed on it. What I see is that many of young researchers do not fully oversee what it is about actually, how difficult life of researcher is, how hardworking it is. Though the same time it is the most beautiful time of your life. Actually, you are young, you have opportunity to get your PhD. I'm now talking, for instance, about PhD trajectory. And then soon, after some months, having visited the town where they come to live for some years, then I start pushing. Of course, I'm very, very strict. Then they realize, oh my God, it really takes some more effort than only 8 hours a week. It's way of living, eh? It's not from 5 to 9. It is way of living, and that is really nice. It is nice to see how it gets through these beautiful young heads, and how they cope with it. And again, we come back and we go back to the responsibility of mentor to keep eye on it and to not let go. We need to coach. We need to be there, to be involved. So together, after some time, you come to first results, and it really feels very good. It's beautiful. So I always try to envision to my students, though it is difficult, though today you didn't have a good paragraph, but think about, we have talked about, write it tomorrow and you will be so happy. Or redo your experiment, rethink the design of your experiments, and then you challenge your young people. We need to challenge them. So the first thing I would say is, it is very natural, it is very normal that they underestimate the research, the whole project, but it is up to us seniors to help there.
Okay, great.
And then the other thing is just a second. So yeah, these are actually the pitfalls indeed, to not oversee how long it takes and how much it takes.
May I ask you a personal question, that how do you support your students, Professor Senada, when they cope with a tough situation, and when they couldn't find the result they earlier expecting, and how do you support them?
Yeah, it's a really very good question, and though I realize it is very personal, but it is also a personal question. So I really then feel I have empathy. I show the empathy. Sometimes you don't want to show empathy; you want to be very strict. But when I see that my young colleague is really suffering because she or he didn't found that what they were looking, and I would be a very bad person to not really feel with them, and to not calm them down, to tell that I also missed, that I also had these troubles, as colleagues said, like 30 times rewriting and going to the post office and so the same with experiments. So you need, and then you take a step back again, as others said, you sit down and you design, and you think every single step through. What I do, I have every week, I have weekly progress meeting with my students and with other colleagues that are involved. Every Thursday morning, I do that, and it really helps. And you really see these little steps. You see how your young colleagues are improving by a week. Of course, not every time it is satisfactory. You don't have every time good news, but these are news. This is research. It is just falling and standing up again.
Great, thank you very much. And I'm sure that you are a very kind, supportive mentor for all of your students. Great. And
they are not here. They are not here. Don't say it twice.
They cannot refute you.
yeah. I always do that kind of propose. They cannot refuse me. Thank you. I'm really very sorry. I have another meeting. My colleague is already, she's starting the meeting there.
Oh.
So I really, first of all, would again like to thank you all, and it is lovely. This is lovely way to come together, though it is online, and I hope soon at least some of us will see each other live. Thank you very much. It is my honor.
Thank you, Professor Senada, for generously sharing your experience and knowledge with us.
Nothing.
And I will be in touch with you for the upcoming project. Thank you very much for your time.
Thank you. Bye-bye.
Bye-bye.
Bye-bye. And Professor Slootweg, let's share the next question with you. Amirhossein, would you please share the next question with Professor Slootweg and send it in chat box?
Dr. Slootweg, what role do you believe interdisciplinary research plays in dentistry, and how can the students benefit from exploring other fields in their research journey?
Yes, well, I would say that you can't do any research that's not interdisciplinary. Nowadays, there are so many advanced tools available that may be helpful. We already discussed the role of a qualified statistician. We have very advanced microscopes in dentistry. We have a lot of biomaterials that are used to fill in jaw defects. So the whole biomaterial research and experimental animals is very important. But the point is that the dental problem should remain the issue, the central point. And from that point of view, the student, with the collaboration of the mentor, should look which other disciplines are necessary. So the choice of the additional disciplines depends on the problem you are facing. And of course, I have seen that in the past that the initial research mostly will determine a more or less fixed collaboration. And so when you're doing in orthodontics, studying cleft palate, by example, cleft palate, then you are turning to genetics, animal experimentation, and that's so a lot of advanced genetic tools and very complicated microscopy. When you are studying biomaterials, then you are more faced with technical issues, also with experimental animals, but a more or less crude histology. And so when you are dealing with saliva, fluorine, and enamel, then of course you will have to do with maybe with physical chemistry or biochemistry. So the kind of interdisciplinary context depends on the oral facial dental problem that's at hand. But without, it will not do.
Great, thank you. And Dr. Shweta, would you please let me share this question with you as well, because I know you are working with surgery department, oncology department, and all other departments at your center, and multidisciplinary research, multidisciplinary approach to the research projects is a very important approach. And how do you deal with this idea?
I think it's really essential to do interdisciplinary research because we kind of like work with colleagues, and pathology is not like something which can go in isolation. We have to have, even in clinical practice, we are uh, on a daily basis, and like I work in cancer, so like if people who work in cancers, they work with oncologists, we work with radiologists and the clinicians, surgeons. So I feel like when you interact with them on a daily basis on a clinical aspect, I learn from them so much, and I'm hoping that they learn from me too. But I feel like we do tumor boards, we do multidisciplinary tumor board conferences. So I've go through radiology and all, and that all comes together in a research project as well. So recently we have been doing some project on HPV cancers, and if almost everybody from all modalities are involved in that, because there's somebody who's procuring that tissue, and there's like somebody who's looking at them, that's us pathology diagnosing the HPV cancers, and then we will do send it out for molecular testing as well. So I think it's beneficial. It's a learning process. And it kind of expands your horizons as well when you do a good job, not only within your department, everybody else will also see how you're doing, and it increases your network beyond your department and your specialty. And you get invited to like conferences and all that. So that kind of like it builds on your CV, and it builds on your career. So it's never not advisable, I would say, to kind of do an interdisciplinary research and expand your horizons with your colleagues.
Great comment. And thank you very much. It's time to wrap up the meeting. Dr. Alikhassi, do you have any comment on the importance of the multidisciplinary and interdisciplinary approach? I know you have conducted many research with the periodontics department, endodontics department, and could you please share your experience with us on this issue?
As Professor Slootweg and Dr. Agarwal said, of course, multidisciplinary researchers is another step of research. I think it is in the next level of researching, and we can learn more than what we have in our discipline. For example, when I do only prosthodontic research, I am answering my question of only my discipline, but when I have some collaboration with other disciplines, especially, for example, periodontics or endodontics, I can learn more about this discipline and I can make newer questions for myself. I know how they approach to their researchers, and it's really good for not only for the beginners, also for the experienced researchers to have this collaboration with other disciplines. They can see newer horizons in the research, I think.
Great. Thank you very much. Words fail to express my appreciation to you all, Professor, and I appreciate your generosity to sharing your experience and knowledge with young scientists from Tehran University and other. I was seeing the participant that we have participants from other countries of the region, and it is very kind of you. Amirhossein, would you please share the certificates of appreciation with the professors
Yes,
here?
for sure. On behalf of SICO's team, I sincerely thank our esteemed professors for their valuable insights. Your expertise has been truly inspiring. Thank you. Now let's move to certificates.
Oh, it's for Professor Shweta. Thank you very much, Dr. Shweta, for your time and attention. And it was invaluable to have your contribution to this program. Thank you,
Thank
Dr.
you.
Shweta.
Thank you. It was my pleasure.
Me too. Nice to contribute.
You're welcome. And Dr. Amirhossein, would you please, Professor Slootweg, thank you very much for your time and
It was my
attention.
pleasure as well.
It's very kind of you. And the
Yeah.
next one, please, Amirhossein.
Thank you very much.
And Professor Alikhassi, thank you very much for your great presentation and for your invaluable contribution. Okay, and Professor Senada, okay, I will share all of the certificates with you. And again, thank you very much, professors, for sharing your experience with us. And thank you, the participants, for being with us. And wish you all the best and have a good day. Bye-bye.
Bye-bye.
Bye, guys.
Bye-bye.
Thank you. Bye.
Thank you very much.